Have you ever woken up with a strange pressure in your chest and wondered why it felt heavier in the morning? A patient once told me she felt her heart race only when she was lying on her left side, and she could never explain why it happened at night, but never during the day. I want you to imagine closing your eyes, settling into your pillow, and unknowingly placing more strain on your heart simply because of the position you sleep in. It sounds surprising, I know. But the truth is that sleep positions influence heart function far more than most people realize, especially after the age of 60. As we get older, circulation naturally slows down. The heart becomes more sensitive to pressure. Breathing patterns change while we sleep, and certain sleeping positions can force the heart to work harder without waking you or sending any clear signal that something is wrong. This is something I see often in my practice. One woman told me she felt completely fine during the day, yet every morning she woke up with a tightness across her chest and a heaviness she couldn't explain. Nothing dramatic, nothing painful, just uncomfortable in a way she had grown used to. When we explored her habits, it became clear that her sleep posture was placing extra pressure on her chest and affecting her circulation throughout the night. Once she made a small adjustment, her morning discomfort faded within days. Sleep is supposed to restore the heart, not challenge it. But when posture, breathing, and circulation shift at night, the heart sometimes ends up working harder than it should. And for seniors, these changes matter. They influence how rested you feel, how your heart functions in the morning, and how stable your overall cardiovascular health remains over time. In this video, we are going to talk about the best and worst sleep positions for your heart, why left side versus right side sleeping can change the way your heart works, how nighttime posture affects circulation, the common sleeping mistakes that stress the heart after 60, and the simple, doctor-approved strategies that can help you sleep more safely and comfortably. By the end, my hope is that you feel clearer, more confident, and better equipped to protect your heart every single night. If this resonates with you, I invite you to subscribe to Senior Health Daily so we can continue this journey of strength, understanding, and healthy aging together. Why sleep positions affect the heart more. After 60. As we step into our 60s and beyond, the body begins to whisper truths it once kept silent. These changes happen slowly and quietly, and sleep is one of the first places where the heart reveals how much it has to work. Many seniors tell me they feel completely fine during the day, but notice discomfort, pressure, or heaviness when they settle into bed. This is not their imagination. The heart truly responds differently at night, especially depending on the position you sleep in. As the body ages, the arteries stiffen, and this means the heart has to pump with more force to move blood through the body. During the day, gravity helps with circulation, but at night, gravity shifts, and the heart must work harder in certain postures. When you lie flat, blood redistributes differently, and if the arteries are stiff or weakened, the heart feels that load almost immediately. Changes in the diaphragm also play a role. With age, the diaphragm does not move as freely. The lungs do not expand as easily. This means oxygen intake dips slightly during sleep, and the heart must compensate by working harder to deliver oxygen throughout the body. A younger heart may handle this effortlessly, but a heart over 60 feels the difference. I remember a woman who told me she felt breathless only when lying flat. She could climb stairs and walk around her home without a problem, but once she stretched out on her back, she struggled to take deeper breaths. Her heart was being forced to work harder because that position increased pressure on her chest and reduced the movement of her diaphragm. When she switched sleeping positions and elevated her torso slightly, the nighttime breathlessness eased within days. The truth is simple but often overlooked. As we get older, our tolerance for pressure on the chest and abdomen decreases. Even small shifts in posture can change the way the heart pumps. Back sleeping, for example, can increase airway collapse in some older adults, especially those with snoring or sleep apnea. When the airway narrows, oxygen drops, and the heart must fight to keep everything stable. Sleep should be restorative, peaceful, and healing. Yet for many seniors, the body quietly struggles each night, and posture becomes the difference between a rested heart and a strained one. When you understand why the heart changes after 60 and why posture matters more, you begin to see your nighttime habits with clarity and kindness, not fear. And this brings us naturally into the next part. Which sleep positions help the heart and which ones make things harder, especially for older adults who want to protect their health for many years to come. Best and worst sleep positions for heart health. When we talk about sleep positions, most people assume that the way they sleep is just a matter of comfort. But for seniors, comfort and heart health are closely linked. Each posture shifts pressure, changes circulation, alters breathing, and influences how hard the heart has to work through the night. Let's begin with one of the most debated topics: left side versus right side sleeping. Many people have heard that sleeping on the left side is better because it improves digestion or keeps the airway open. But in reality, the effects are different for older adults, especially those with heart concerns. When you sleep on your left side, the heart sits lower and closer to the chest wall. For some seniors, this triggers palpitations or a fluttering sensation. This happens because the heart is slightly compressed and becomes more sensitive to its own motions. Some people describe it as feeling like their heartbeat is echoing inside their chest. This can be uncomfortable, especially if you already have a condition like mitral valve prolapse or atrial fibrillation. Sleeping on the right side, however, often reduces this sensation. The heart rests more comfortably without being pushed against the rib cage, and blood returns to the heart more smoothly. Several studies suggest that right-side sleeping can improve circulation and lower the heart's nighttime workload, especially in older adults with heart failure or irregular heartbeats. Now let's talk about the position most seniors assume is harmless: sleeping flat on the back. While this position may feel neutral, it often creates the most trouble. When you lie flat, especially with a pillow that lifts your head too sharply, the airway can narrow. Snoring increases. Breathing becomes less efficient. The diaphragm cannot move freely, which forces the heart to work harder just to circulate oxygen. This combination increases nighttime heart stress. Seniors who sleep on their back are more likely to wake up with morning heaviness, palpitations, or unexplained fatigue. I have seen seniors who sleep flat on their back begin to breathe better and sleep more peacefully simply by shifting slightly onto their side or elevating their torso. Stomach sleeping creates a different kind of challenge. When you lie on your stomach, the chest is compressed, making the heart and lungs work harder for oxygen. It also twists the neck and upper spine, which can affect nerve signals and breathing patterns through the night. For seniors, stomach sleeping is rarely recommended because the pressure on the rib cage can make nighttime circulation less efficient and put unnecessary stress on the heart. Gravity is always working with or against the heart, depending on the position you choose. It is not about sleeping rigidly or perfectly. It is about understanding that your body changes with age, and the position that felt comfortable at 40 may not be the position that supports your heart at 60 or 70. Now that we understand how posture influences heart pressure, let's explore how these positions affect circulation and oxygen flow more deeply. How sleeping posture affects circulation and oxygen flow. One of the biggest misconceptions seniors have is believing sleep posture affects only comfort. In reality, posture changes how oxygen moves through the body, how easily the heart circulates blood, and how efficiently the lungs expand during rest. When you sleep in a position that compresses the chest or reduces lung expansion, oxygen saturation can drop slightly. This does not always wake you or cause dramatic symptoms. Instead, it shows up subtly. You may wake feeling anxious, even if nothing stressful happened. You may feel foggy or irritable. You may feel tired even after 8 hours of sleep. Many seniors dismiss these symptoms as aging, but often they reflect nighttime oxygen dips caused by posture. Poor alignment can also trigger nighttime palpitations. If your neck or upper back is misaligned, nerve signals that regulate heart rhythm can become disrupted. Seniors sometimes describe this as feeling like their heart is pounding louder or faster at night. They imagine their heart is suddenly acting up, but in truth, certain positions create small stresses in the body that the heart tries to compensate for. For older adults with microvascular circulation issues, these shifts matter even more. Tiny blood vessels become more sensitive with age, and a posture that reduces blood flow slightly can create significant changes in how the heart feels and works. This is why so many seniors describe waking up suddenly with a racing heart or feeling like their chest is tight for the first few minutes of the morning. Your nighttime posture influences your morning energy, mood, clarity, and heart rhythm. It shapes the way your body transitions from rest to wakefulness. And when you begin to adjust your sleep environment with awareness, you give the heart a chance to rest rather than struggle. Now that we understand how posture influences the heart, let's talk about nighttime habits that quietly stress the heart and often go unnoticed. Nighttime habits that stress the heart after 60. Sometimes it isn't just the posture itself that impacts heart health. It is the habits surrounding sleep that put pressure on the heart long before you lie down. One of the most common hidden stressors is going to bed right after a large meal. When your stomach is full, your diaphragm cannot move freely, and your heart has less space to function comfortably. Acid reflux increases and often pushes pressure upward into the chest, which wakes many seniors with a sense of heaviness or discomfort. Another common habit is using too many pillows. Many seniors stack pillows hoping it will help them breathe better, but the angle often ends up too sharp, bending the neck forward and restricting the airway. The heart must work harder to compensate for the limited oxygen flow. I remember a man in his 70s who slept on 3 pillows for years. He believed it helped his snoring, but the incline was so steep that his airway narrowed even more. When he switched to one supportive pillow and a slight mattress elevation, his nighttime heart strain improved dramatically. Late-night caffeine, alcohol, and even mild dehydration also impact the heart. Alcohol can cause your airway to relax too much, increasing snoring or airway collapse. Caffeine can make the heart more sensitive to nighttime rhythm changes. Dehydration thickens the blood slightly, making circulation more challenging, especially in seniors. Even tight or restrictive sleepwear can alter breathing patterns. If the chest cannot expand fully, the heart compensates by increasing effort. This is subtle, but over time, it contributes to sleep-related stress on the heart. Bedroom temperature plays a role too. A warm or stuffy room raises nighttime blood pressure and heart rate. A cooler environment helps the heart rest more consistently. These small habits often seem harmless, yet they accumulate. Once seniors become aware of them, the difference in sleep and morning energy can be remarkable. With these habits in mind, let's explore the hidden risks you might not see but the heart feels every night. Hidden heart risks. While sleeping. Some of the most serious nighttime heart risks develop silently. They do not cause dramatic pain or sudden symptoms. Instead, they unfold quietly while the body sleeps. Sleep apnea is one of the biggest risks for seniors. Even mild apnea can drop oxygen levels repeatedly throughout the night. Each drop forces the heart to respond urgently, increasing pressure and destabilizing rhythm. Many seniors with apnea never wake up fully, so they assume nothing is wrong. Yet their heart works harder throughout the night than it does during daytime activities. Snoring, too, can affect heart rhythm. Every interruption in breathing creates a brief moment where the heart must compensate. Over time, this constant adjustment can weaken heart resilience. Morning heaviness or chest pressure often reflects nighttime strain. Seniors sometimes wake up feeling as though something heavy sat on their chest for hours. This is often a combination of poor posture, shallow breathing, and oxygen dips. Acid reflux can also mimic heart symptoms. When stomach acid moves upward, it creates pressure in the chest that feels frighteningly similar to heart pain. Many seniors rush to the hospital thinking they are having a heart attack, only to learn it was reflux worsened by posture. Even the mattress matters. A mattress that is too soft or too firm can misalign the spine and compress the rib cage. This subtle pressure increases nighttime heart workload. Once you understand these risks, it becomes easier to adjust your sleep environment with care and intention. And that leads us to the mistakes many seniors unknowingly make while sleeping, sleeping mistakes that hurt the heart. After 60? Some mistakes are simple habits that become automatic over the years, but once corrected, the heart begins to rest more comfortably. One of the most common mistakes is lying flat on the back for too long. This position can cause airway narrowing, make breathing shallow, and force the heart to work harder. Many seniors who experience nighttime palpitations find relief simply by shifting slightly onto their side. Twisting the spine while sleeping can reduce lung expansion and alter breathing patterns. When the lungs cannot move freely, the heart must increase effort to maintain oxygen flow. Sleeping on the left side can also trigger palpitations in seniors with certain heart conditions. The heart is closer to the chest wall in that position, making its motions feel louder or more intense. Poor pillow support misaligns the airway, making breathing inconsistent throughout the night. Even slight neck pressure can reduce airflow enough to stress the heart. Restless sleep, frequent tossing, and nighttime tension increase adrenaline levels. When adrenaline rises during sleep, the heart responds strongly, sometimes waking seniors with a racing pulse. Understanding these mistakes allows seniors to sleep with more awareness and compassion for their bodies. And now we arrive at the part that empowers change, the adjustments that help protect the heart night after night. Doctor-approved sleep adjustments for heart protection. Helping the heart through the night does not require dramatic lifestyle changes. Often, small and thoughtful adjustments make the biggest difference. For seniors with high blood pressure, sleeping on the right side often supports better circulation and reduces nighttime pressure. It allows the heart to rest without feeling compressed. The ideal pillow height is one that keeps the neck aligned with the spine. Too high restricts breathing. Too low allows the head to tilt backward. A supportive pillow that maintains neutral alignment helps the airway stay open and reduces the heart's workload. Side sleeping with a pillow between the knees keeps the spine aligned, preventing pressure on the lungs and improving breathing patterns. Breathing becomes easier when posture is gentle and the chest has space to expand. Sometimes the smallest adjustment, like shifting an inch forward or backward, can transform how the heart feels at night. Hydration throughout the day supports blood flow, making nighttime circulation easier. Gentle stretching before bed relaxes the diaphragm and chest muscles, allowing deeper breathing. If you ever wake with morning heaviness or nighttime discomfort, it is worth noticing your sleep posture. The body often gives signals long before anything becomes dangerous. And finally, we must talk about when sleep-related symptoms deserve medical attention. When to seek medical advice about sleep-related heart symptoms. There are certain symptoms seniors should never ignore, especially when they happen during sleep or early in the morning. Nighttime chest pressure, even if mild, deserves evaluation. Morning palpitations that happen frequently indicate the heart may be working too hard at night. Waking up gasping or choking is a red flag that the airway is collapsing during sleep. Unusual fatigue after a full night of rest suggests that oxygen may be dropping at night. Dizziness or headaches upon waking often reflect poor nighttime breathing or circulation. If these symptoms appear repeatedly, it is important to speak with a doctor. Some symptoms require urgent evaluation, while others can be addressed through scheduled appointments. The goal is not to create fear, but to create awareness. Your body speaks, especially at night, and it deserves to be listened to. As we come to the end of this journey together, I want you to take a slow breath and remember something important. The signals your body gives you at night are not signs of failure. They are quiet messages. They are small whispers from a heart that has carried you through every season of life, asking for a bit more kindness, a bit more awareness, and a bit more support. Even after 60, the heart remains one of the most adaptable organs in the entire body. It can strengthen, it can heal, it can find stability again, and it responds beautifully to small changes that honor the rhythms of age. A slight shift in posture, a gentler pillow, a calmer bedtime routine, a moment of breathing before sleep. These simple choices can create powerful improvements, not just in how you rest, but in how you live each day. I often remind my patients that the heart has never once abandoned them. Through grief, joy, stress, and countless nights of worry, it has continued to beat, silently and loyally, without asking for anything in return. Tonight, allow yourself a moment of gratitude for the work it has done, decade after decade. It has been your protector, your engine, your companion, and it still wants to keep you safe every single night. If something feels wrong, trust that instinct. Your intuition is one of the most reliable tools you have. When your body sends a message, listen closely. Caring for yourself is not an act of fear. It is an act of love. Thank you for spending this time with me. Stay connected with Senior Health Daily so we can continue guiding you toward peaceful sleep, a protected heart, and a stronger, steadier life. You deserve rest, you deserve clarity, and you deserve to feel safe in your own body.